Hello everyone, welcome to another episode of TooHealthTalk, the show where we get to share about real health challenges and give honest conversation about what's happening in our daily lives. On this episode, we have a very special guest. She's one of the best gynecology here in Abuja, Nigeria, and I'm so excited and proud to have her in our show today. The person of Dr. Khan. Doctor,
Yes,
welcome, Doctor.
thank you so much.
Yeah,
I'm also happy to be on this talk, health talk with you.
thank you so much, Doctor. So like I've been working with you for quite some time, and I've gotten so many reviews about how like you get to solve ONG problems. So I don't know how like were you born to study gynecology or you just picked interest in it?
Well, I think since being a child, I can remember I used to play like a doctor, nurse
Oh,
with my dolls. I will give them some little cuts here myself intentionally, and I use
whoa,
plaster on the doll. So my doll actually was a wounded doll all my 1, 2, 3 years that she was able to survive with me as a child. And then when I was growing older than that, and I
yeah,
realized there was a time I went to the hospital
mm,
in Edinburgh because
wow,
I used to stay in Oyo State.
wow,
So that's where I spent my, should I say, my childhood. So I went to the hospital, and that's the first experience I had. And it was when I got there. Obviously, I was scared. There was this lady there. She was a nurse. She was wearing white. She was so sweet, and I almost fell in love with everything she was doing.
mm,
When she said, "My dear, I'm going to give you an injection," I really didn't know what an injection was at that time. I was about maybe 7, 8, and she took me to the room, injection room, and there she pulled out a syringe, and I was looking at it, and I was like, "What is she doing?" I didn't know what injection was.
yeah,
And she pulled out, and she told me, "I'm going to give you this." I was like, "Will it be painful?" She said, "Sweet pain." That's how she
wow,
described it. I was like, "Okay, what is sweet pain?" My dad was outside of that injection, after the
yeah,
injection room. So she gave me the injection. Initially, yes, it was painful, but she kept her hand there. I really felt something about the whole thing. And she said, "Wow, this profession is so good because even the pain was not made for me just to be. I mean, I didn't feel it that way. And that's how I grew up and fell in love with medicine.
oh,
It
wow,
was when I went to ABU that obviously that's where I got admitted, and I was in the north that time. So my medical career started when I was doing, actually, for ONG. My passion started after I
oh,
graduated.
oh, okay,
When I did my house job, my first posting was in ONG. We rotate
yeah, rotation,
between.
yeah,
It was in Kaduna Teaching Hospital of ABU, and it was something where I learned something else about ONG, and that's when I realized that I want to do it. Because initially, any department you go, you fall in love with it. You went to surgery. Oh, I want to be a surgeon. I went to anesthesia. I said, this is where I will be. At that time, you're not really. You're just falling in love with all the departments. But when I went to do my house job, and I went to ONG as my first posting, I just loved the joy.
wow,
The joy that anything you do for them, the mother is so happy. I know there are cases when you can't do anything, but let me say, most times you bring joy. When a lady delivers a healthy baby, you can imagine the joy. A patient comes to you, she's infertile for 2 years, and she comes to you, she becomes pregnant. It is so joyful. I know it's not me doing it. I still believe that it's God that is doing it, because I only know God cures, and
yeah,
He is the one that puts everything in. So it's just that. It's just that there's little passion you should put in every patient, and that's what I do for my side.
oh.
Every other thing comes from God. That's what I believe.
Oh, nice.
Yeah.
So on today's topic, we're going to be talking about ovarian cancer. So like, what is really this cancer that is killing a lot of people now?
Well, it's not a very common cancer, also not one of the, it is on the high something, but it's not really killing so many people, let me say that way.
Okay.
Rather, the cancer that has more chances of killing and that's more prevalent is the breast cancer and the cervical cancer. Ovarian cancer comes lower down. Yes,
Oh,
it
okay.
does come, but it's again in the older age group.
Okay.
Yes, like 70 above. You understand? It's not a common cancer among the young people, or even between the age of 40 to 50.
Oh, so
Yes.
are there any signs?
Ovarian cancer, when it presents, only comes with signs. When it is advanced, when it is in the early stages, you hardly have any signs to say this is ovarian cancer problem. Yes, a lady may see some changes in her, but they are not really, obvious. So that is the thing. So when they present is when they are much older. Obviously, it has gone further from the ovary, like advanced cancer.
I've had some people talk about IVF treatment that can lead to cancer at some point. Is that true?
It's not IVF treatment. You see, the lady is given many medications, which include hormonal stimulation. Yeah, when you have bombarded a lady with a lot of it, I'm not saying direct cause, but maybe. You understand? But it's not as if it is because of that. Anything that changes your system, anything can happen. Malignancy occurs when there's a change, a mutation, and that can happen anytime.
So can PCOS lead to ovarian cancer?
No, PCOS does not lead to ovarian cancer. PCOS, which stands for polycystic ovarian syndrome, is a risk. There's a risk in if somebody has PCOS, there's risk of developing endometrial cancer, which is uterine cancer.
So can you give us a brief explanation about PCOS?
PCOS is a polycystic ovarian syndrome, PCOS for short, is a hormonal imbalance in a woman, which leads to some changes in her hormones, female hormones, and elevation in what we call male-like hormones, which we call androgens. So androgens increases in the system. So what happens because of this imbalance, female hormone and the presence of androgen, there is also presence of what we call insulin resistance. You understand? Now all this will lead to ovarian dysfunction. Ovary will not function well. And that leads to changes and symptoms which we call something like menstrual irregularities. They don't see their menses on time, or they are seeing scanty menses. They have skipped period, that means some months they're not even seeing their period. That is one. Then because of the presence of the androgen, they start seeing changes in their body, like hair-like distribution, male distribution. Some people develop some hair under their chin, on their legs, on their hands. It's very possible. Then acne, very problematic acne can develop. And sometimes they have other changes because of insulin resistance. They tend to have some changes towards having diabetes,
Oh,
diabetic thing, and they become very obese, overweight. All these are the common symptoms PCOS people can have.
is there a treatment plan?
Well, PCOS does not have direct plan, but we treat the symptoms. So it's more like a symptomatic treatment. If somebody comes with, like, she's not able to have regular menses, we treat that part. Now, some people, as they grow older, fertility concerns is also very important in such people. So what we do is, when they have PCOS and they are now having fertility concerns, we have to treat them accordingly. So it's not as if we treat with one drug all of them.
Oh, so what's the common hormonal imbalance in PCOS?
Right? The female hormones and the presence of male hormones, which we call the androgens. So this is the problem in it. And because of that, we need to now look at how we help them reduce, but basically everything is to help them reduce these hormonal changes, balance it with something they can go on for long. And that's why lifestyle modification is very important in such people.
So when you talk about fertility, are they more like of twenties of our generation now that gets to have these issues of PCOS and
PCOS is seen in reproductive age group, which is between 15 to 45. Yes.
oh,
So anybody can come between this age and say they're not, with complaints that they have.
oh.
And PCOS is not just taking just one, you have to do tests to see are we really dealing with
Yeah.
PCOS.
So now let's go back to cancer. Can late night phone use or not sleeping well lead to this hormonal imbalance that can cause cancer?
Um, Hormonal changes, yes, we can expect from having erratic sleep pattern, stress life. That's true. It can lead to hormonal imbalance, but cancer is a different thing altogether.
Oh, okay.
Cancers are caused by mutations. what causes those mutations are some very important, what we call triggers. But having this is not a direct relationship to cancer.
Okay, for fertility, are they in this our present generation? Are there issues of Have you treated more issues of infertility?
Oh, yes.
Is there any reason
No,
where
infertility has, if you talk about infertility on its own, it has multiple causes, multiple reasons why a young lady or any lady is not able to conceive. So that is a different thing altogether.
Okay, so for PCOS, back to PCOS now. So is there, like, if we're going to say, okay, let's refer this patient to Dr. Khan. So is there any plan, like, is there any, like, steps you would say, okay, do this, or come if you are feeling this way in social stage?
Now, the thing about PCOS is, you see, many times people don't come when there's no issues. It's only when they have problems. PCOS may have been in the system. I mean, like she may be having the problem, but may not have the exact
Exactly.
symptoms. So she may not, but she comes when she has symptoms, which could be either menstrual problem or some hair problem or acne problem. Those concerns. Even older comes will come with fertility. Now, each of our treatment is individualized. We don't treat one person with one thing altogether. So if somebody comes with menstrual problem, she will be evaluated after physical examination, evaluated, and accordingly she'll be treated. If somebody comes with issues with weight gain, it's a different thing altogether. So we are going to now examine, check, evaluate, do all the hormonal checks, and then see which treatment suits her. However, the common thing for all of them is lifestyle modification. That one is for all groups, whether it is menstrual problem or whether it is obesity issues or related to any other thing. You need to understand lifestyle has to be modified in PCOS or in any other condition as well, because somebody has to eat well, somebody has to eat healthy, somebody has also to understand in diet. We're checking how the patient eats the right thing. And that goes for every condition. We want everybody to be healthy. That's one. Number two, because of the risk of obesity related complications or diabetes related complications, in such people it is emphasized. You
Oh,
should
okay.
eat healthy, you should eat well, and you should know calorie count is also important, so also in the obesity. Another thing is exercise, because you can't do one and leave the other. Exercise has to be part of our routine. After that, sleep and always reduce stress,
Mm,
because stress triggers the problems again. So
okay.
all these things is not one time, it is over time you discuss,
Yeah.
discuss, and many people heed to it.
Okay. So there's a issue on Twitter. Was it last week that women should freeze their egg if they reach some particular kind of age? If not, they're going to have issues with it, with giving birth.
That's a different thing altogether, and moreover, let me just say something. Egg freezing is not a usual thing we discuss with every woman. Egg freezing is for those that we know may not be able to, I mean, like they're not planning on a conception presently, career minded ladies or something. And we know when they get to a level, the quality of egg will reduce. Probably they want to get married or they want to have a baby in 40s. At that time, the quality of egg is poor. So it's these people that are not ready to have a baby, maybe between the age of 22 to 20, 40, they can freeze their egg. But that option is only if they are not planning to have a baby right now and they know they're going to have it later on. Sometimes, yes, egg freezing can be possible, should be routine in those that are going some major like kind of treatment such as radiotherapy. But if a young lady, for instance, she has cancer of somewhere and she has to go through radiotherapy, radiotherapy means some rays are being directed into the body, and so ovaries, sorry, are very sensitive. Any changes of such may destroy the egg, may have problems with the egg. Later on, it may lead to mutations and congenital issues can come in if she decides to use those kind of egg. So such people will encourage, please freeze your eggs before time, because they are going through a therapy which we can't stop. Do you understand? So that is why we can freeze egg in such category of people. So basically, egg freezing is highly individualized. It's not as if everybody should go and keep their eggs for no. There are people we should look at, evaluate. After evaluation, we know who are going for egg freezing and who are not. Again, how feasible is it? Is it something that everybody is ready to accept? It's not something very common. There are particular people we direct it to, but it's not a common thing to everybody. Otherwise, everybody will think egg freezing is the only way of keep making their next populate I mean, to populate the next world.
Yeah. So, lastly, what advice would you give to a 25 years old lady that wants to give birth now or maybe later in the future?
My advice to every young lady or any lady is please understand that we're living. It's a cycle. The whole reproductive thing of a lady, her reproductive life has a cycle which it starts, it gets to the peak, and then it declines. Now, if somebody conceives at the peak level, the chances of having successful pregnancy is much higher. When you decide to have it when you're declining, the ovarian thing is declining, the chances of having conception is very low, chances of having mutation is also high. The egg can have, that is why you see it's related that the maternal age, older maternal age, there's risk of having children with Down syndrome. So to prevent that, it's always a better option to marry early or have babies early. As you have babies early, you know that you have, you won't go to that state of having such thoughts in your mind. But it's everybody's choice. But remember, career can be up and down. But once in our environment where fertility concerns and motherhood is a pride, we should always think of having kids earlier. And if one wishes not to have more, that is their choice. But at least don't delay. If you delay, there is chances of having either problems, medical conditions, psychological issues, and obviously other conditions. If the baby has some problems, it's always the mother that's blamed.
Sure, sure. Thank you very much, Doctor, for coming on the show. I so
Thank
much
you.
appreciate your presence, even with your busy schedule.
Thank you.
You
Thank
find
you.
out time to be here today.
Thank you.
Is there any tests you can recommend? Like lastly, 5 tests or that you want, like younger females to come and meet you, or like five for like maybe on our last show we talk about regular health checkup and why people need to do regular health checkup.
Yeah, when you do a regular checkup, you're doing a general checkup.
Oh, okay.
And that is important. So it's after that you now see the specialist.
Specialist, okay.
Depending on the results that you see. So
Okay.
as far as health checkup is, please go ahead. Every woman should do a health checkup, which is inclusive of cervical pap smear and the others. So when they come to me, they already have some issues. So I know now what to handle her with. You understand?
Okay.
So for me to say go and do this is like.
Oh, okay, okay. Thank you very much, Doctor. And if you've watched up to this point, thank you very much for watching up to this point. And please, for you to support what we're doing here, please like, share, and subscribe to this video. Thank you very much. See you in the next episode. Bye.